Prem, who has been a really powerful spokesperson for justice in the House of Lords. Welcome, Prem. Thank you for speaking.
Well, good evening, everyone, and it's a pleasure to join such campaigners for social justice. Now, social care is absolutely vital for everyone because we are all just one serious accident or illness away from needing social care. So it is not something which is for somebody else, it is for ourselves. And when you look at the statistics about the residents in care homes, you will find that over half the money is spent on people of working age. The majority of people in social care tend to be elderly. So that again means that the issues which we are looking at matter to everyone, and they are vitally important. What's been happening around us is that successive governments have used a well-trodden path to privatization. The standard formula has been degradation of publicly owned healthcare services by starving them of resources. They then become dysfunctional. Then somebody walks in and offers privatization and market-based solutions as the only viable alternative. That has been tried out in the National Health Service, where large parts have really been privatized. The same formula has been applied in social care. Indeed, social care has been the test bed for the neoliberal ideas. As Rachel mentioned, most of the care homes, care beds are now under the control of large corporations. And many of you would have noticed last week, former Prime Minister David Cameron promoting an insurance-based approach to social care. Last year, former Health Secretary Peter Lilly put forward a bill in the Lords arguing the case for social care, for insurance-based social care. And that bill mercifully never got anywhere, but I think they are just testing the water here. Now, social care is under the control of local authorities, which is really a throwback to the creation of the National Health Service in 1948. The sick were farmed off into the NHS, and the care went into local authorities. Local authority funding for quite a few years has been squeezed. Between 2009-10 and 2020, local authorities have experienced a 37% cut in real terms in the grants that they receive from central government. That then affects the amount of money which they can spend on social care. As Rachel mentioned, in 1960, it was publicly owned care homes which provided social care, but now 84% of the care home beds are controlled by corporations. There are around 17,000 care homes with 400,000 or so residents. Last year, local authorities received some 1.9 million requests for social care for various periods, and this included 578,000 from working age adults. There is an increase because of austerity, which creates all kinds of problems for people, especially mental anguish. In last year, local authorities spent £26 billion on adult social care, and half of that went to working age adults. Financial help, as Rachel mentioned, is means tested, though Boris Johnson promised us that there would be a new cap of £86,000 of the kind of life spent. And that actually is not good enough, and I will come to that in a moment. The resources which are given by local authorities to care homes are never really reaching the front line of service. The main reason for that is profiteering. Just to give you two examples, Runwood Homes, which operates care homes, operates on a profit margin of 37%. Avery Healthcare has a profit margin of 41.7%, which means that for every £100 that they receive, just over £60 is reaching the front line for care. Too many care homes engage in financial engineering, especially those controlled by private equity, and they are actually avoiding taxes as well. So they are being funded by taxpayers out of the tax pot, but they are putting very little back. Social care sector has about 1.62 million staff. About 24% of these are on 0-hour contracts. Over 40% of the domiciliary staff are on 0-hour contracts. And that does not exactly motivate staff to do a great deal. The median wage in care homes is £9.50 an hour, and 165,000 vacancies are out there, and indeed care homes are earning less. Care home workers are earning less than supermarket workers. I have a member of family who's been in care home for many years, and every time we visit or every time we phone, there's a different person we speak to. So there is no real continuity of care, because people come in and they leave fairly quickly as well. So rather than ending privatization, which is siphoning off money in profits, or curbing profiteering by care homes, former Prime Minister David Cameron suggests that people be forced to buy insurance. And of course, the problem here is there is no insurance company which is willing to offer an insurance policy to cover social care. So the novel idea he and other Tories are pushing is that the government should go in the business, either on its own or with an insurance company, to sell social care insurance. This simply is not viable at all. And these are my arguments in a nutshell against that. If you look at the actual cost of care homes, the fees can range anything from £27,000 to £39,000 per annum for residential care home. But if you need nursing support, the fees are between £35,000 and £55,000 a year. So what would the annual insurance premium be to cover that kind of cost for 3, 4, 5 more years? Now, Cameron isn't really forthcoming, but last year Peter Lilly suggested a number. He said that all people need to do is make one-off payment of £16,000, and that would be it. That is just a joke. No way a £16,000 insurance premium would cover you for the costs which I actually mentioned. Now, let us imagine that 16,000 number is realistic for a moment. Where exactly are people going to find this £16,000? Not under their pillow. A quarter of UK adults have savings of less than £100. That is a lifetime savings. 1 in 3 people have lifetime savings of only £1,500. The median household savings are just £12,500. So people at the median level can't afford to pay even that £16,000 insurance premium. The next thing the Tories suggest is that people can offer a charge on their home and borrow the money and make the insurance payment. So let's look at that. The problem here is that the home ownership is declining. In 2003, just over 70% of the homes were owner occupied. The most recent data we have suggests about 63% are owner occupied. But that percentage declines dramatically when you move to ethnic minorities. Black Africans, only 20% of them own their home. They basically live in rented accommodation. Arab people of Arab descent, only 17%, and so on. The younger people are unable to get on the housing ladder. And indeed, when they're getting on the housing ladder, it is much, much later in their age. And what is happening is people are still paying mortgages when they retire. So the idea that you have this kind of a house waiting, which you can just remortgage, is simply not on. And what is also happening is that many grown-up children are unable to get on the housing ladder, so they're living in parental homes. And the idea that you remortgage to generate money means that you're going to start turfing out children after children have to leave the home. Many elderly people I have spoken to are already raising money out of their home through equity release schemes because they can't live on the state pension, which is incredibly low. And their children can't provide the social care. So it simply does not add up. or whatever they're trying to do. So the insurance approach would help the ultra rich who have £16,000 or more just sitting under their sink in a kitchen somewhere. The rest of the people will not be able to afford it at all. So we need to do the following. We need to push out corporations from social care. That would just that act alone would release 30 to 40% of extra money, which at the moment is going in profits. We need universal social care, free at the point of need, funded out of general taxation. That is for everybody. And in order to fund it, there are many ways. But since these days people only talk about tax and spend, so let me just suggest a couple of ways. We can simply eliminate the tax anomalies or the tax perks for the rich. Here are some examples. If we tax capital gains at exactly the same rate as earned income, at the moment they are taxed at a far lower rate, and we also forced the capital gains recipients to pay national insurance. At the moment they pay zero, even though they use social care and the NHS. That alone would generate about £25 billion a year extra. If we tax dividends in exactly the same way as earned income and charge national insurance, that could raise £8 to £10 billion a year. If we reformed tax relief on pension contributions, at the moment, 2/3 of that goes to people who pay tax at the rate of 40 and 45%. The remainder goes to about 2/3 of the workers. Well, that would generate another 10 billion spare. At the moment, national insurance is payable at a rate of 12% on taxable income up to 50,270, but only 2% on income beyond that. Suppose we charge 12% on all the income, that would generate another £15 billion. And this by no means is a conclusive list. The point I'm trying to make is that the money is available. What is not available is the political will. And that is what we have to change by informing each other that we must never, ever accept the argument that we can't afford it. What we can't afford is the misery, the pain for people.
That's a fantastic last message to end on. Thank you very much, Prem. Now, I know you have to leave in a couple of minutes. So I was going to ask if anyone wants to have one or two questions for Prem before you go, Prem.
I can wait about another half an hour.
Oh, okay. Well, let's take the couple of questions that have come up now, because we're going to have the main question answer after 7 when I think you do indeed have to go. So I've got Sarifa Patel first to speak, and then Rona. We may not get past that, but I've got one other after that. Sarifa, could you unmute?
Hi everybody. I'm Sarifa Patel. I'm part of Win Visible group for disabled women and that. And my question is, there's a lot of us disabled women, people of colour, who face a lot of institutional racism, which the organisations and local authorities don't like to believe, but it goes on, and that's the reality of our life stories. And then some of us, even me, I was pushed into in 2004 to go into a Sahara homes, a care home, and I didn't want to, but I had good allies who fought with me, and it didn't happen for me. But I wouldn't have had the funding to do that anyway. But it's funny, when they want to do that, they've got the money, but they haven't got the money to give us the direct payment we need to look after our disabled children properly in the home. And I was just wondering whether you, as as a big campaigning group, are going to do something about the discrimination and the barriers that we disabled mothers face, people of colour especially. And we often get put on, and other mothers as well, we often get put onto child protection unnecessarily. And I just think it's really diabolical that they don't want to support us, but they've got the money to put our children in care homes where they get abused, or us in care homes. Thank you.
Thank you, Sarifa. I'm not sure if that was directly to Prem, but that's the point of this section. But Prem, do you have any comments on that?
Oh, well, thank you. And thank you, Sarifa, for sharing that information with all of us. And it is really heartbreaking to hear what people go through. I think the most important thing is to give visibility to what is ignored and marginalized. Share stories with other people through the media, social media, the print media, and everywhere else. And also mobilize civil society organizations to promote the problems you face and call for reforms. Certainly, if issues come up in the Lords, I'd be delighted to give visibility to these issues. But I think it has to be a never-ending battle, and we all have to unite to make sure that everyone gets the justice they deserve.
Thank you very much, Sarifa, and thank you. A couple of minutes. I'm going to take two more questions. Rona Topaz, please.
Good evening, everyone. I wanted to ask Prem. I know you're sort of like speaking from the perspective of the House of Lords, but I'm actually more concerned about what's going on in the House of Commons insofar as, particularly since the last general election defeat in 2019, the opposition seems to have been moving further towards the centre-right. And I'm particularly concerned that if we were to have a Labour victory at the next general election, it wouldn't necessarily guarantee that social care would be substantially changed in the way that we would all like it to. I don't really believe that the Labour Party are in favour of the increase in capital gains tax, for example, or in finding the money from the sources that you mentioned. I feel like at the moment, I feel like politically things are a little bit hopeless as far as disabled people are concerned, and I'm just wondering what your thoughts are.
Thank you. Over to Prem.
Well, thank you, Rona. I think the world we live in has always been volatile, and that there is always political movement. It is us to make sure that it moves in a direction that we prefer. So, we can't just sit back and just watch others take the initiative. And would we get the kind of social care that I am sort of calling for? Well, there is no invisible hand of fate. It is a kind of fate which we create for ourselves. And the world we live in is always in the process of being made. So what we have to make sure is that it is made in the way that benefits all of us. And that is what we have to do. Would Labour go for capital gains reform? Well, it isn't for lack of trying on my part and many others. I've been quite heartened that for quite some time in the House of Lords, even some Conservative peers have begun to call for taxing unearned income in the same way as unearned income. Of course, there's been opposition as well to every time I speak to that idea. But I think we have to popularize the ideas in such a way that they sort of would appear to many people to be a natural thing to do. And so the point I'm trying to make is that the kind of world we are calling for can easily be provided. Money is there, finance is there. And just to let you know, a few weeks ago, I invited a group called Patriotic Millionaires to give a seminar in the House of Lords, which was attended by a lot of MPs and peers. And these are some of the richest people in the UK. And what was their bottom line message? They were saying to the government, please tax us more, please eliminate tax anomalies, because we want to see social justice. And I was really heartened by their call. So basically, we all need to spread the message that, the kind of things which we are calling for can easily be funded. There's no reason why they can't. A country which can bail out banks, a country which can hand quantitative easing of £895 billion to the City of London. It can fund social care, even if it takes extra 10, 15, 20 billion. That's not a lot of money. All we need to do is give political parties a push, The bottom line has to be, I'm not telling you to which party to vote for, but the bottom line has to be to any political party, do you want our vote? Tell us how you will deliver social justice. If you're not going to deliver it, sorry, we can't vote for you.
Thank you very much, Prem.